This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, welcome back. This is Dr. Deepak Megur. She's a 60-year-old lady who has hypermature Morgagnian cataract, and we expect a liquefied cortex under the capsule. I'm not sure about the health of the zonule, so in the worst case scenario, I may have to convert to scleral tunnel incision intraoperatively to convert it into manual SICS. So in this case, I've planned a scleral tunnel incision to begin with. So the capsule is stained, the chamber is pressurized with OVD. Now is the time to perform the incision. So I go ahead and stabilize the globe, and 1 millimeter behind the limbus in the sclera, I make a transconjunctival scleral groove, and then I'm going to use the 2.8 keratome to create a tunnel, sclerocorneal tunnel, and then enter into the eye at least 1.5 millimeter beyond the limbus. So the goal is, in the worst case scenario, if you have to abandon phaco and convert, I can extend this sclerocorneal tunnel on either side. So that's the idea about using this incision in this case. So I expect the liquefied cortex to pour out as soon as the capsule is punctured. I'm using a 26 number needle to just create a flap, and as soon as the needle punctures the capsule, we can see that the liquefied cortex just oozes out slowly. I'm just trying to irrigate out the fluid using PSS. Now this is a hydrodissection cannula where I'm just trying to empty the bag so that visualization is clear. So the moment I go in with the forceps, again more fluid comes in, so come back and again redo the irrigation. Just I'm trying to ensure that majority of the liquefied cortex is flushed out. So OVD is placed back into the chamber, the flap is held with the forceps, and the rhexis is initiated. So although there is still some oozing of the liquefied lens matter, the rhexis could be completed, and during rhexis I am always observing whether their zonules are weak. Doesn't seem so, the zonule seems to be healthy, but I realize now that the rhexis which I have created might not be of ideal size, because the nucleus which I'm going to deal is quite a dense nucleus. So I need to enlarge it again, go back and inject OVD. A micro scissors is used to make a tangential snip at the rhexis margin, and then a forceps is utilized to enlarge the rhexis. So now we have a decent sized rhexis. Time to deal with the nucleus. The nucleus is mobile, and that is a challenge. We don't have any underlying nucleus or cortex. So immediately below the nucleus, we have the posterior capsule. And dividing this nucleus is also not going to be easy, simply because it's quite dense. Again, as we remember, for a successful chop to happen, the impalement of the tip has to be deep enough into the core of the nucleus, and to achieve that, I'm going to create a small trench or a pit which is about 2 mm in length in the central part of the nucleus. But the problem here is, while trenching, the nucleus would be moving around. So I'm using my second instrument, that is the blunt chopper, to hold the nucleus stable as the sculpting is being done. Once about 30% of depth is reached, now is the time to perform the chop. In this case, I'm using a blunt chopper to perform the horizontal chop. So in these cases where we don't have an epinucleus and the nucleus is freely mobile, I always prefer to use the horizontal chop technique, simply because it's more physiological and there's less likely chance of inducing any pressure posteriorly, because the vector forces are acting horizontally against each other. So the tip goes in and buries into the substance of the nucleus. The blunt chopper goes in and hooks the endonucleus, and then the chopper is pulled towards the phaco tip. So we have a crack now. It is full thickness, but it does not traverse the entire length of the nucleus. So the nucleus is rotated, and similarly the next chop is being performed. The tip goes into the substance of the nucleus, the chopper goes in and hooks the endonucleus, and then it is moved towards the phaco tip. So now we have a loose fragment, and these 3 fragments are still attached to each other at the bottom. OVD is replenished into the eye. Time to deal with these 3 pieces where they're held together by a posterior plate. I'm just trying to use 2 screws to mechanically separate the posterior plate. It is partially successful. One pair of the nucleus are still not totally free. They are holding each other. So time to emulsify these fragments. The anterior most free loose fragment is first emulsified. So the remaining pieces again are held, and these 2 adjoint pieces, when they come together to the phaco probe is destroying the bridge which is holding each of them. So these 2 fragments have become separate. So we've got now 3 fully free fragments, and each of them is consumed at the level of the rhexis margin in a controlled manner. Very little cortex is there, few fibers are there. I go in with my bimanual I&A system and then just strip off the small bits of cortex which is present. So time to implant the lens. The OVD fills in the capsular bag, and then the single piece hydrophobic lens is implanted into the bag in a very controlled manner. My right hand, which has got the irrigation handpiece, the tip goes under the lens matter to flush out all the OVD which is behind, and the OVD in front of the lens is aspirated as well. That's the time to close. Side ports are iterated. That's it. The case is done. To summarize, when the nucleus is mobile and like this one, and you have a fairly dense cataract which is free floating, I always prefer to go in with the horizontal chop technique. The reason being, the vector forces are acting horizontally. There is lesser chance of inducing any stress on the posterior capsule, and the horizontal chop is a very physiological way of dividing the nucleus. If the pieces are joined at the posterior plate, then usually in this small nucleus, it is the posterior plate can flip up into the anterior chamber, and these posterior plate adhesions can be destroyed with the phaco probe itself. Again, these fragments would be pushed down and then emulsified individually in a controlled manner. Thank you for watching, and hope you found this helpful.